Well, the recent news that former President Jimmy Carter has decided to transition to hospice care has brought hospice care now to the forefront of people's minds. And it's something that doesn't happen all that much because, frankly, it can be a little uncomfortable to talk about because, in essence, talking about hospice care means we're talking about imminent death coming soon. That's not something people like to face or talk about, but it's important to do so for you or for a family member. And that's why we want to do it now. And I'm so happy to have with us right now Dr. Ross Albert, the medical director for hospice and palliative care at Hartford HealthCare at Home, just a division of the overall larger brand of Hartford HealthCare. Doctor, thank you so much for joining me today.
Thanks for having me.
We're really glad to have you here to have this discussion. And I was just telling you right before the commercial break, I don't think we've ever even talked about hospice care here on the morning news. So it's a good time to talk about it, maybe to dispel some myths or to talk about when people feel like it's right for them. And how do you help guide people into making that decision?
Yeah, it's definitely something that people are hesitant to discuss, and it's something that we need to open up the conversation about. I think we talk about hospice when we talk about people's goals, about their wishes.
Yeah.
For President Carter, he reached a point where he was shifting his goals from doing more aggressive care. He was going through treatment for a brain mass and in and out of the hospital, and he and his family elected to shift to focus on care at home and receive medical care at home, which was that idea of bringing hospice in to support that care at home.
All right. So what are the benefits when people decide to go to the hospice care, specifically at home route?
Yeah, it brings more support. So hospice care brings a team of people to support their care at home. It brings a nurse or nurses, a social worker and spiritual care to support both the patient and the family. The Medicare hospice benefit covers medications. It covers the equipment and oxygen people might need. So it really supports people with focused medical care on keeping them safe and comfortable at home.
And I know we keep saying at home. I just want to touch on that a little bit more.
Yeah.
The actual home aspect of it. How much does that matter to people?
It matters a lot. And we say home, but it can be wherever that person considers home. So it might be their house. It might be a nursing home or an assisted living facility. But it's that idea that, when time is short, and the hospice benefit is for people who have a predicted prognosis of less than 6 months. That's just a prediction, of course.
Yeah.
But it's the idea to say, if my time is shorter than I wish it was, where do I want to spend that time? How do I want to focus that time of my life? And that's why we focus on being generally at home for people.
And I'm glad you mentioned that because I had neglected to ask what exactly qualifies a person for hospice care.
Yeah, there's generally two things. The first thing is around that prognosis, that prediction from the hospice physician and your own doctor around a predicted life expectancy of less than 6 months. We never have a crystal ball, of course, but we have some data and recommendations that might guide us there. And the other is, again, that shift in focus from more aggressive or invasive interventions to shifting and saying, we're going to forego those types of things and elect for a more comfort-focused plan.
I'm curious if you've seen any myths or misconceptions out there. I don't think I have any, but I can imagine maybe some people might be a little hesitant thinking that if I'm going at home away from a hospital setting, maybe the quality of care might diminish a little bit.
Yeah, I would say the myths around quality and around medications probably are the two things. One is that idea that you're not foregoing medical care. You're just shifting medical care to this team that specializes in supporting you at home. So the quality is actually made better by having a hospice team involved. I think the other myths are around people thinking that a team is going to make them do things, to make them take a whole bunch of morphine, to make them take, to speed up someone's passing.
Yeah.
And what the data actually shows is that by including the hospice team, by focusing on people's comfort and symptom support, that actually their prognosis, their life expectancy is not changed at all and might even be slightly improved by having a focus on their comfort and quality rather than all those invasive interventions.
In some cases, is it more of a whole family decision because the patient, him or herself, might be of a diminished capacity in any way? How does that work?
It is. So when somebody isn't able to make their medical decisions, or when someone makes it in conjunction with their family members, their medical spokesperson would make the decision. So in Connecticut, that would be focused on either their next of kin, or it's somebody who's named positioned as their healthcare representative, which again emphasizes the idea that we should be having conversations earlier on about our wishes and our goals with the person who might be speaking for us down the road.
So if somebody wants to get in touch with you or any of the good folks there at Hartford HealthCare at Home, how can they do it?
So for me and our organization, it would be we have a 1-800 number. It's 1-800-HOME-CARE. But the other side of it would just be to go online and look at Hartford HealthCare's websites, as well as things like the National Hospice and Palliative Care Organization, to get generalized information as well.
Okay, so if you're facing this tough decision anytime in the near future, hopefully Dr. Albert is helping you get off on that right foot and take those first couple of steps. So thank you so much for joining us today,
Thank you very much.
It's been a pleasure to meet you. Absolutely.
Thanks.